Hello, today we're just going to talk a little bit about physical therapy and working with patients with dementia. So first we're just going to introduce the condition with a quick video that describes um, it if you
What
haven't
is
heard
dementia?
about dementia too
Dementia
much.
is the name for a group of symptoms that commonly include problems with memory, thinking, problem solving, language, and perception. In a person with dementia, these symptoms are bad enough to affect daily life. Dementia is not a disease in its own right, and it is not a natural part of aging. Rather, the symptoms of dementia are caused by different diseases that affect the brain, including Alzheimer's disease. Dementia is caused by a loss of nerve cells. It is a progressive condition, meaning that symptoms gradually get worse. This is because when a nerve cell dies, it cannot usually be replaced. As more and more cells die, the brain starts to shrink. This can sometimes be seen in a brain scan of someone with dementia. These scans show a slice through the middle of the brain from the front, like looking through the middle of a stick of rock. They show what happens to the brain of someone with Alzheimer's disease as their dementia progresses over several years. Note how the black areas become larger. This is because the brain tissue, the grey areas, continues to shrink or atrophy as nerve cells die off. Common symptoms of dementia include problems with day-to-day memory, concentrating, organising and planning, as well as difficulties with language and visual perception, and changes in mood.
Okay, so we're just going to cut that off there if I can get this mouse to work. There we go. Okay, so then after hearing that, the big question is, well, can patients with dementia benefit from physical therapy? And the answer to that continues to be yes, that they're finding. One of the big ways that they've found that people can benefit is in their cognitive functions. Since there is that cognitive decline associated with dementia, they've actually found that patients that are more involved in physical activity or patients that attend routine physical therapy have shown slowed signs of that decline. One study that followed a group of patients where half of them just went about their normal daily routine, and then another half attended physical therapy for an hour 3 times a week, found that the group that did attend the physical therapy had positive impact on their mini mental state exam, which is a state that they use a lot. A test that they use a lot with elderly patients to look at their orientation, memory, attention, language, and visual spatial skills. Um, so, yeah, there's a lot of research that's been saying the same thing, that helps just to slow uh, some of that impact of the decline. Um, Another big thing is looking at the fall risk for these patients. Since they are elderly, they're more fragile. A fall can be a big deal if it happens to them. So, uh, with some of the studies, they were looking at the tug scores for these patients, again with the study that had the group that went to their routine and the group that attended regular physical therapy. And while they didn't have a difference in the time of their tug scores, by the end of the study they did find a difference in the amount of steps taken, and that it had decreased, so they were having longer, more normal steps versus when they started and they were like little short steps that they had to take a lot to get through the whole thing. Um, then another article that looked at a series of different studies to review them had 5 of them that were on balance, and 4 out of the 5 found that there were positive impacts on the balance of the patients that partook in physical therapy by the end of the study. So that's just 2 ways that it can help with fall risk. And then another issue that people have been looking at a bit, they haven't had as much conclusive research on it, is just the psychological benefits for the patient, just being engaged in something, talking to people, getting active, if that can help with some of the depression and anxiety associated with dementia. which is just another interesting thing to consider. Um, so some tactics for working with these patients are just to stay positive. It's can be very challenging to work with these patients, so it's important that you go in with a positive mindset and remember that you can in fact help these patients, because if you're going in just thinking, well, what's the point, a lot of the time that shows up in how effective your work ends up being, whether you're trying to or not. Then also is just to try and be as positive of impression on them as you can give, because believe it or not, they can retain memories of their impression of a person, so it's important to try and be someone who comes in and is pleasant, smiley, like you're friendly to them. If they aren't having a bad day, at least try and be comforting. Um, just try and make them feel comfortable and welcome when they're with you. Um, and then always just smile. Like, sometimes you don't know how long it's been since they've seen a smile, so that can help make a difference for them. The next thing is just to treat every patient as an individual. It's important to remember, no matter where they are in the disease progression, they are still a person. So you have to look at what motivates them, just what makes them who they are, and using that in your treatment sessions can help a lot, just to help engage the patient and get them involved with the physical activities. Um, then another thing to consider is just some of the tests and measures that people use for the elderly population. There's a pain assessment, an advanced dementia, mini mental state exam, functional assessment staging tool, timed up and go, figure eight walk test. There's a whole bunch of different ones, but it's important to just know some of your different options when you're working with these people. And then lastly, just keep always expanding your knowledge. There's always more research going into dementia, what works, what doesn't work with it, even looking at those tests, which ones are effective, which ones provide the best results in showing change or not. And also, if you can, just attend continuing ed that's geared towards dementia and working with geriatric patients. It can help a lot and teach you a lot so that you can better provide care for these patients. So that's the end of our presentation. Thank you for listening. And these are my sources. But yeah, thank you.